Deliberate, Lord, on the issues that are nagging every nation on the global map. So we as Zimbabweans, we are gathered here to deliberate and to discuss and to hear from the presenters. And we want to commit this meeting that it becomes a success. Even the moderator want to commit here that at the end of the day, we want to be equipped, we want to be better people to do our work with in the different situations that we find ourselves in. We want to thank you, dear Lord, in Jesus Christ's name, amen.
Amen.
Let me just say all protocol observed so that I don't miss anyone. So COVID-19 pandemic has adversely affected the entire globe. In sub-Saharan Africa, COVID-19 has exerted pressure on already strained health systems. Many African countries and third world countries are still struggling to access vaccines. Zimbabwe, for a change, is among a few African countries who are doing extremely well in terms of COVID vaccination. So I really want us to applaud the country of Zimbabwe. I thought there would be a clap from other members. Allow me at this moment to thank the government of Zimbabwe through its Minister of Health and Child Care, represented here by Dr. Piri, will be joining us, for being very proactive in their response to COVID-19. Especially when it comes to COVID-19 vaccines. As an organization, we are running a campaign called Vaccinate Our World. So globally, what we're aiming for is to improve access to COVID-19 vaccine. For those who are, you are journalists, the media, people from the media fraternity, if you've been reading around, you realize that in terms of distribution of vaccines, between the third world and the first world, there's a big discrepancy. If you look in the first world, some of them already have 60-70% of their population already vaccinated. But in Africa, it's below 10% of the people already vaccinated. So the issue is not issue of, olden days we used to say it's issue of the availability, issue of money, resources to procure those vaccines. Yes, there is an element to that, but now the issue is the vaccines, most of them are manufactured in the first world. And unfortunately, what has happened, most of the first world countries, they've already procured in advance. They already procured some of the vaccines for even unborn children. They already have their vaccine dose already reserved for them. Yet in Africa, we still struggle in terms of access to vaccines. So that's why I congratulate the government of Zimbabwe for being proactive, because they pre-ordered the vaccines well in advance, so that at least they are available in Zimbabwe. So well done to the government of Zimbabwe for being proactive in terms of vaccine availability. However, there's a challenge. Initially, there was issue of hesitancy, which is still around. But as we go, people are now accepting vaccines. Gradually, people are going to go get vaccinated. But if you realize there's still others, I think it's moving from hesitancy. Now I think I can call it resistance. People are really resisting COVID-19 vaccines. This hesitancy, or as COVID-19 vaccine hesitancy, or what I want to call now resistance, is promoted by, among other things, general mistrust of modern medicines from the West, especially for a new phenomenon such as COVID-19. Also, the issue of faith. And what is also affecting is issues of underlying diseases. When Veneko introduced me, she spoke about HIV. I'm passionate about people living with HIV. It's not very clear whether a person living with HIV can get their COVID vaccine. There are no clear guidelines. So that's why they're important constituents for us. We are really, as an organization, quite passionate for people living with HIV. They need to have clear guidance on what to do. Can they get their vaccine? It needs to come out very clearly. So that's the reason for this gathering. Also, there's no clear guidance in terms of pregnant women, whether they can access. So we need clear guidance. I'm hoping ministry will be able to help us in that context. And there's also general lack of correct information, especially in the social media. So we need correct information to be distributed or to be. As an intervention to promote vaccine acceptability among communities in Zimbabwe, AHF Zimbabwe has come up with this idea of media breakfast, meeting in which experts in COVID-19 will provide information that will hopefully help demystify myths and misconceptions about COVID-19 vaccines. Also present here, like I said, is ZNP+, represent people living with HIV. There's also National AIDS Council here, and also other community representatives. We are hoping this will be an opportunity for information sharing between the experts and the community, and also the media fraternity, so that at least we have correct information as we leave this room. Let me lastly continue to congratulate the government of Zimbabwe for leading in terms of COVID-19 response. Thank you for the ministry, for the great work you are doing in coordinating the response to a disease that is new, hence not having a reference point, but you are managing it very well. So thank you to all of you. I thank you.
Now we're going to hear from the Zimbabwe National Network of People Living with HIV, and representing them today is Clarence Mademuza, and he's going to come and give us, I believe we're doing a presentation. Yes. So pull out your pens and papers, let's take notes. I believe that we are looking at basically the community voices is what I'm going to cover. What needs to be done to fight COVID-19? So this is groundwork, this is the voices from the people on the ground, the capacity and scope of the research that ZNP has done. So we're going to hear from Clarence, and we look forward to dissecting what he has to say kind of up here. So
thank you very much for this opportunity. So I just want to thank Mr. Mandimuza for the presentation and also for the Kutabila platform. But maybe my worry is on, programming is age specific sometimes. So these myths were covering the whole population. So I think it's also wise if we could see the myths and misconceptions that are directly coming from young people, as well as the myths and misconceptions that are coming from adults. So this will actually help when it comes to the implementers or the programmers that would want to address some of this, or to come up with programs that will help the targeted population. Thank you.
Sorry, before you stop, I am challenging you today to speak as a young person. I know that they do the research, but they do research from speaking to young people like yourself. So you're welcome to also speak as a young person and tell us what some of the needs and misconceptions are, and how best to communicate NEMA youth in a language that they understand, so that our discussions today are less about raising more problems and more about finding collective solutions. So if that's okay with you, what would you from the top of your head do to speak to young people and help address those needs and misconceptions?
All right, so I think the first important thing that we need to know is that young people, they feel more comfortable to discuss these issues with other young people. Mm-hmm. I think one of the most challenges that we face as young people is the attitudes of the adults who treat us as their kids when you want to have access to this information. So it's really difficult to answer some of the questions that we discuss. So it's really important that when we are programming or doing things for young people, I think it's high time we don't just focus on youth engagement, whereby we treat young people as beneficiaries, but we also want to focus on the issue of youth leadership and meaningful youth participation, which means that young people will be able to, maybe this platform is okay. Yes, I want to acknowledge what he said when it comes to the issue of saying we have a hash where you can press and talk to young people, but it's an online platform. We are communicating using a phone, and sometimes it eliminates a lot of things. So it's better if we capacitate. We have a lot of young people, for example, from different organizations who are peer educators, who are community adolescent treatment supporters. Maybe it's really important that we do a multi-sectoral response when it comes to the issues of COVID-19, not just to focus on one platform or one activity. It really makes it better, but maybe youth on the ground should mainly be responsible for collecting this information. Thank you.
Was on the issue of the shift from hesitancy to resistance. In Mr. Mademutsa's presentation, he didn't allude to anything scientific. Aren't we doing anything scientific or innovative, medically innovative as a country, to see to it that there's more adoption of these vaccines, like local testing centers for these vaccines, working with UZ, maybe medical institutions, verifying the real scientific components that are within these vaccines. What are we doing in that regard to see to it that the people know that we have tested these things as a country? And my second question was in relation to indigenous knowledge systems. People have been hesitant to will continually resist taking these vaccines based on the fact that they've survived perhaps the past 2 years through using indigenous knowledge strategies like the Zumbanis and all those other, the Bute, all those other things that we had could make one survive COVID. How has been the adaptation of those same systems alongside vaccines as a complementary means to curbing COVID? That's my question.
Thank you for that.
Thank you. I just wanted to thank the presenter for talking about persons with disabilities, because what he said about the distance and how COVID-19 is affecting persons with disabilities, I just wanted to ask, there are other persons with disabilities who take medication so that maybe they have pains, the back pains, because the disabilities are different, and some of them, they do take medicine. So is there any effect when it comes to the vaccine and their medication? Because you realize that as persons with disability, you are really scared to go to say, I want to be vaccinated. So at the end of the day, you end up without being vaccinated, especially to young people, because you realize that young people with disabilities, they are not easy to reach, because most of them, they should be accompanied by parents, to go out there, especially if you are using a wheelchair. You need an assistant to go out there. So at times, the parents are even not really there for them to say, let's go and get vaccinated. Once he or she is vaccinated, maybe about the young person, it's a secondary issue. So I just wanted to say, for those because there are some with multiple disabilities, which can make them move around easily. So I really wanted to know what is really being done, so that maybe I can suggest to say, maybe we go, you arrive at a village, then you go under a tree, but then that young person is not even able to get out of the house to go under that tree. What are some of the measures that can really be done? Thank you.
I just wanted to find out just about another group of persons, that is people living with mental health issues. I didn't hear you saying anything about them. Definitely, we are in a country, even globally, where youths are taking a lot of drugs, illicit substances, and that group of that population also needs to be addressed, their needs, because I remember even at the Paris group of hospitals, at the annex psychiatric unit there, we also have patients who come with, we used to come with the COVID-19 conditions, and their isolation and so forth was quite a challenge. And also on a community level with their families, how can we make sure that these people are also access these vaccines?
It's that reflection that probably what we need to do is to go granular. Granular meaning that we need to go specific in terms of group by group. But I do take it, I believe what we'll also do going forward is that we will make sure that we look at each group specific issues and misconceptions. But definitely young people are by young people, platforms for young people. That is our point of emphasis, that we need to have messaging that speaks to specific groups. The general messaging is good, but where we are now going, we now need messaging that speaks to specific groups and specific subgroups. We cannot have messaging that is, broadcasting, or at least that doesn't necessarily touch those groups that have the most misconceptions. There are groups, the young people, people with disabilities, they're actually left out because of the challenges that they face. So let's have messaging that speaks specific to the subgroups, the groups that are there. Key populations have issues, youth have issues, older persons have issues. Now let's have messaging that speaks specifically to those subgroups.
What about even using celebrities or ambassadors? I know that some of us might remember that nationwide campaign a few years ago that was conducted about circumcision. They used names and faces that young people resonate with. They made songs, and they made these particular ambassadors go on radio, go on TV, talking about the experience, making circumcision seem cool and possible. So how come with the COVID vaccine, we haven't seen organizations like yourselves, even AHF, internationally using, ambassadors? I'm sure young people, from a show of hands, would you listen to, Winky D or Ja Praiser if he said, I've been vaccinated? Would you? Yes? No? You would not? Is this one too sensitive? Is it too personal? You wouldn't listen. There's a hand. Can we get the other mic for the room?
To some extent, celebrities play a role in able to give information or to help. For instance, what you were saying, Kuti, in terms of vaccination, we didn't see maybe celebrities or anyone campaigning and stuff. Maybe to some extent, shaka contribute kuti vanhu vakawanda vasa vaccinated. And education, I think apana kunyatsa kuitwa proper education kana kuti vanhu havana kunyatsa zvangonzi vaccine yabuda, the next thing takuona his excellency vaccinatwa. Apana kana mboitwa campaigning. I remember when circumcision, what you were saying, I was in high school at that time. Educating us, circumcision, this and that. And a lot of people were circumcised. But vaccination,
Yeah, thank you for that. And science isusu tirikuite kusimbisa vanhu vemuzimbabwe kuti no tareceiva Sinovac, Sputnik, asi isusu taita double verification yedu semazimbabwe, so zvinoenderanawo here nerudzi rwedu izvozvizvi. So what is it that is stopping us from taking lead in science as well, or even creating our own vaccine?
I think I can come in.
Sure.
I'm not an expert, my expertise in HIV management, but I think as a medical personnel, maybe I can just comment and contribute.
Sure.
We are hoping Dr. Gede will be joining us around 11. He's a specialist who deals with what we call immunology. So he'll help us in terms of understanding the COVID vaccine, what it does, and different vaccines, the mechanism of action. So I think most of these will be answered when he joins us a bit later on. But maybe just to say, what are we doing in Zimbabwe? Generally, anything that comes into the country, be it from the condoms, from any medicines which come into the country, before we use it in this country, it undergoes some testing, and these testing are done by Medical Control Authority of Zimbabwe, MCAS. So they do a thorough test on them, thorough test on the vaccines to make sure they are not harmful. But like you were saying, Rufeneko, I think there will be more which needs to be done in terms of research. Yes, we've checked everything. There are no contamination. The vaccine is there, everything. In terms of efficacy of that vaccine, but we still need to do more, like Rufeneko, you were saying. I think we need to do more as researchers, local researchers in Zimbabwe. But what is key also to note is we've got great scientists actually producing most of these who are Zimbabweans. I happen to know one of the doctors in Pfizer who is actually Zimbabwean. He's one of the co-producers. So I think if you can get those Zimbabwean scientists who are helping maybe producing the Pfizer vaccine, coming up on TV, even on ZTV, to say, guys, I'm one of the core. So we give them access so that at least they can talk to their people. I'm one of them. Then I think it's an issue of trusting. If it's coming from your own, you can trust it. If it's coming maybe from outside, that's why I think one of the issues we say these Chinese is already an impression of failure to trust them. But if we have a local scientist who can say, yes, this thing can work, I think we can go a long way. I think I also need to touch on a very important point you brought up, the issue of traditional medicines. What are we doing? And I understand there is already some research going on in terms of Bute. I think you asked something about Bute. I'm not really saying let's go for Bute, but what we are saying is if there is that need local, let's do research and make sure we have our local solutions for local problems. So I think that's a trajectory we need to push for as a country, to get local evidence to be used locally. Thank you.
Thank you very much for that. Do you want to add to that point, or is it kind of belabored? Because even the WHO itself keeps coming up with information, then going back on it, and then, it's a scary time. But if we hear from our own, no one simply that.
Yes, thank you so much. So definitely in terms of the issue of the approval processes, definitely Medicines Control Authority of Zimbabwe has gone through the necessary tests to ensure that these are bona fide quality vaccines. So I think that's the messaging that also needs to continue to permeate amongst communities. And I'm also aware that the MRCZ has been, or at least gazetted a few months ago, those eligible for the vaccines. So we had an interface with MRCZ because PLHIV were not a part of the list of those eligible for the vaccines, and they did share a revised circular that also includes people living with HIV. But what we're now fighting for is also now that people living with HIV, become one of the priority populations under the vaccination program.
Sure. Thank you.
We need also to keep it aside and say there are people with COVID-19 induced mental health issues. So COVID has really caused a lot of damage in terms of social networks. Some have lost their relative, they didn't get an opportunity to say goodbye. There are a lot of issues around COVID-19. So we need to look at COVID-19 induced mental health issues, how best we can deal with them, how best we can support those people with mental health issues. If people, when they say mental health issues, I was hoping these are the experts actually get the table there. So I think they can help us more. There's no expert here in terms of mental health issues. I think that table is full of mental health experts.
Not issue experts.
Experts, yeah. I was very careful not to say that. So what I wanted to say is, let's unpack this issue of COVID-19 mental health issues. because this is a key issue. When people talk about mental health, they think of someone who's already in the street, but they're not thinking of people already having mild depression, severe depression. So we need to take care of those people before they get into
Sure.
So I think it's an area which we all need to look at. Sometimes people are failing to sleep. It's already a sign maybe that there's issues there they are not dealing with. So I think let's also discuss about that in and around. So I think explain the table.
I think so. I like that contribution.
Involving, people with, mental health challenges, or even, some organizations that, take care of those. And I'm not so sure whether ZimCare managed to come, but we actually, approached them because it is very critical, to have them in the backdrop of COVID-19 issues. But probably they are not here. Yes. Oh, okay. Yeah. That's very good. Thank you so much for coming. I hope you are going to say something with regards to this. But I also want to kind of challenge our own system in terms of addressing mental health issues. To say, I think there is little appreciation really of seeking help from professionals. And therefore you have to have your own mechanism of dealing with that. But I want to say that at the stage where we are, where actually we have a lot of people affected COVID, I think it's a high time that our psychologists, our social workers will actually need to educate our people in terms of the referral pathways. Where do you go in case that you are affected? So I think we need such kind of structures to be well marketed so that our people know where to go. Capacitating even the guardians for for those people who take care of people with mental challenges. So I think it's a discussion that we need to take up seriously. Thank you.
Commenting on as a medical professional, I think this pandemic, of course it happened, it affected many countries, and Zimbabwe is one of them. So to really control information, especially that young people hear every day, it's quite difficult. But as a country, we need to, like you mentioned earlier, to look at this as a multi-sectoral approach. And also, I'm glad that the media is here. They also need to help to disseminate information that is key to vaccine uptake. So there's need to work together, because even though people can hear what is needed, or they can hear why they need to take the vaccine or the importance, if they hear on the social media platforms that it kills people, they might not be willing to take it. So as a country, we need to work together to design new strategies or platforms to disseminate proper key messages in terms of vaccine uptake. Thank you.
Our question was the expectations on government on promoting vaccination. So point one was the government should do more awareness campaigns on vaccination in order to, number one, eradicate my myths. I think there is, or there are, a lot of myths on vaccination. I know, etc. And assure, number two, fifth point is to assure the public on the safety of vaccination. Yes. So point number two, government should procure more vaccine and education, and also to make them available to everyone. Maybe kuti ma schools you can get vaccinated on the nearest school. Say like what they do in the National Blood Services. Kuti you can go and donate blood pakati something to community. But nowadays wanawachada kufamba a long distance. Then number 3, availing resources and policies regarding vaccination, and to make it clear on the age limits. When on 14 years then on the ground maybe they're being turned away, and the information yacho inongonzwa kuti post cabinet yataura chakati, but on the ground it's different. Point number 4, to provide manpower and incentive to people within the health community. Point number 5, to promote vaccine intake, like giving shopping vouchers to my youths, being innovative, drive through chaya. Pakati pani drive through nogona kwenda kunobaiwa, it's less than 3 minutes. Uri mota mako imomo unogona ngobaiwa jebrako. Giving free meals, t-shirts, caps, like what they do my political party rallies.
My t-shirts and shop.
Yes, my t-shirts. Avoiding politicizing my vaccination program. Then to educate my traditional healers, my church leaders. Because when I wonder that pastor edu akabaiwa saka nini ndakutenda kunobaiwa kana kuti ningabaiwa, so I think very safe. Yes. To educate my young people so that my primary schools, you know what you wanna do.
Okay, your 5 minutes is run.
Yeah. Thank you so much.
Okay. So you can stay there. Thank you, Tafaza.
Group B, we're looking at Zim's responses to COVID-19, the good and the bad. Basically, we managed to come up with about 10 good aspects and about 13 bad aspects that Zimbabwe realized in terms of COVID containment. So the initial 10 good things that government did was firstly, conforming to the WHO COVID containment measures. We felt Kuti as a first precursor when government took the initiative to say COVID was a global pandemic that was in the right stride against other governments, like what happened in Tanzania and other countries globally. We ended up not experiencing such kind of ills. The second thing was coming up with the COVID-19 response teams. We felt that when government came up with the national as well as provincial COVID-19 response teams, they managed to create platforms from which responses to containing COVID could be derived from. The third thing was lockdown enforcement. We felt that when government enforced the lockdown as was done globally, they did a positive thing in terms of containing COVID. The fourth thing was rollout of vaccines. We felt that in rolling out vaccines, they gave the population the medical requirements in order to deal with COVID. And in that regard, it was a very important, good thing that Zimbabwe went through. Provision of PPEs, we believe that provision of protective materials and making them cheap also was a good thing that government in Zimbabwe envisaged in terms of dealing and containing COVID. Awareness campaigns were the other thing. There were a lot of awareness campaigns that aimed at redressing the adverse effects of COVID-19. We also felt that the daily statistical updates in Zimbabwe were also a good thing because, they could be used for planning and availing more information as to what was really transpiring on the ground. Another thing that we felt was good was the preparation of interaction reviews. There was a lot of review action amongst peers to see to it that a lot of information was availed as to how COVID could be contained. We thought that this was also a good move. Establishment of quarantine and isolation centers was also a positive stride in terms of government's efforts to mitigate the effects of COVID-19. Availing access to vaccines was also another thing that was very good about government in Zimbabwe's efforts to contain COVID. Furthermore, availment of these vaccines in rural areas was also a further advantage. We also felt that the good thing about Zimbabwe's response mechanism was having political leaders taking to the front and being some of the first people to be vaccinated. I believe you remember Dr. Chiwenga was one of the first people to be vaccinated. And, this also motivated other people that the government had actually, in essence, interest and support of everyone to be vaccinated. So now we move.
Okay, I'm presenting on the role of media in encouraging and promoting vaccination. The roles of the media are to encourage, the roles of the media are to educate, entertain, and inform the public. In this case, we're going to focus on the educating and information part. Point 1. The agenda-setting role of the media, like how we frame our headlines, is in accordance with who and the Ministry of Health push to achieve herd immunity. Point 2, the media is there to inform the public on the myths and misconceptions surrounding the COVID-19 vaccines. For example, zvambotaurwa nakufa zvekuredusa effectiveness of my ARVs, blindness, nekusazvara, etc. And also on the information part, it helps the public make an informed decision pakuchuza like vaccine avari kuda nekusiyana kwavo by providing information on my efficacy rates chichichi. Point number 4, the media is also there to obtain information from the public and then inform policymakers on what the public thinks of the vaccines. Point number 5, the media also gives COVID-19 survivors or those who were vaccinated the chance to share their experiences so that it might motivate someone to also get vaccinated. Then the last point, the media also gives people updates on the COVID-19 situation and the vaccination drive. Thank you.
Thank you very much. First, we defined a wave as a sudden rise in cases. Thank you. So, the waves have been associated with climate As you can see, in winter we had had like a sudden surge in cases, holidays, people traveling from different places in the country as well as coming in from other countries. And also the virus is self-mutating. So we identify 6 aspects that can help us manage the waves and also prepare us for any upcoming waves. The first one is to strengthen the prevention and control measures of COVID-19. This is also keeping in mind that even though the cases have died down, we still need to maintain our COVID-19 prevention and control measures. That is wearing of masks in public places, also provision of washing points and sanitizing points in public places, and following the quarantine guidelines. The second point is to identify those who are vulnerable to mixing vaccines due to demand barriers and take remedial measures. The third one is we need to advocate for vaccine access and acceptance. We need to demystify myths and misconceptions regarding vaccines so as to promote the uptake of COVID-19 vaccines. There's also need to engage stakeholders like this platform that we have. Everyone needs to be on board so that we promote the uptake of COVID-19 vaccines. The fourth one, we need to increase awareness as much as possible. Even though it's a pandemic and there are many platforms already addressing the issue, we need to increase awareness in our own context. That is strengthening health education in all age groups on issues to do with COVID-19, its implications and importance of taking vaccines. The fifth one, there's need for proactive action in screening mental health issues, intensifying psychosocial support services, as well as addressing the effects of COVID-19 pandemic, such as the social livelihoods of people that have been affected and also people that have been frontline in COVID-19 prevention. The sixth one, we need to increase access to COVID-19 testing. That is provision of COVID-19 tests in public points that are affordable to everyone and accessible. Thank you very much. That is all from our group.
Thank you very much.
Director, thank you. Thank you, Mr. Chikwati, for creating this platform. Clever, I know you've been working very hard for this to happen. I think when you started, the house was empty and you were like having butterflies, and then the house was overflowing. Now we are now happy, but not knowing what to do with us at lunch. But I'm very happy to be in this meeting. I actually had to come back from Kwekwe, from another meeting to attend this particular one. I have a passion for the media, the journalists. You just don't know how much power you have in your hands. Munenge mambo akagara achizviita village work. Ivo vari mambo vari kufanirwa kunge vachitonga dunhu. Your presence in this place says a lot. It says a lot of passion which you have for health. It says a lot of passion which you have for your nation. And I believe you also want information about yourself. Sometime last year, around March, we went to Uzumba Maramba Pfungwa following the First Lady. She was going to talk to the elderly about COVID-19. When we started talking about COVID-19, flu, nobody really thought kuti izvi zvakamboitika nditi. Takatanga kuona mapicture ana 1912 zvichiitika. For your own information, there was an elderly lady there. Akati iyi flu iyi takamboiona. Denda iri takamboriona. Nguva yedu taitonzi dunhu nedunhu garai ikoko musafamba. musabuda mudunhu renyu, musavhakachirane, denda rikapera. Saka mbuya vanga vari very convinced kuti if we do the same now, denda rinopera. Mwene mwe ngaagare paari, tirege kufamba, tirege kuvhakachirana, denda rinopera. I've also heard Dr. Ngwenya from Blawai. I asked myself, this wave yapera, there is another one coming. So I asked one of the medical doctors, why is he always coming out and saying there is a third, there is a fourth wave coming, here it will kill more people than it has done? No, it's because his father experienced pandemic yakamboitika yakada kuita seishi. So he knows his father shared with him that information, and that the information which he is sharing with all of us, so that we are alert. Tisangoti zvapera izvi tobva tati mamask edu pasi, social distancing hapasisini. So as we, imemi media, you are the ones we are supposed to share. During our time, when you went to, please can I have the floor? Thanks. Ukaenda na driver to cover a story. Wakudzokera ku office, taurira driver zvawanzwa kumeeting. Ukaona usingagone kutsanangura kuna driver zvawanzwa kumeeting, kureva kuti newe futi hauna kuzviita sei, hauna kuzvibata. The number of stories we are going to see coming from this platform will show us whether you got something or you did not. The way you are going to articulate these issues. I was listening as we're talking here. Issues of the youth. My youth hana kufanana. Youth wako Highfield hana kufanana na youth wako Nzvimbo. Hana kufanana na youth wako Borodale. Hana kufanana futi na youth wako Chitungwisa. So how are we going to approach them and talk to them so that we hear their concerns? You also realize that the use of the celebrities, why? Havana kurwara here nechirwere. Maybe let's start nevakarwara. Vachitaura kuti takarwara, tikapora. Then tozoenda kuna vanozoti, ndakazobaiwa, ndakazovaccinate without money. Dr. Chikwati, we also, when we did our webinars, I'm sure Clever, you participated or somebody, that challenge, we saw it. We are to zotaura nezve-COVID musicians. Murikutipa mari. All right, kana muchida mari, garai zvenyu kumba. Tichawana vamwe vachataura. Imi makagara zvenyu kupi? Kumba. So it's tricky. Even patakaita medical male circumcisions, celebrities were used. But in Dova Kankava Pamberi Takuvanzwa 3, 4, 5 wives, girlfriend, Varuana Vaita say, are they exhibiting the desired result? So when we plan these things, let's think about it. So I am excited to the Zimbabweans who are scientists, who are part of the production or manufacturing of this. If they are available, if we can have contacts so that we can, the media houses can utilize, they can approach them, they can share the story. The challenge at Tatoona and Equity at Satashkapa level ipapo, because the number of authorities we had invited to this meeting, whether they are really committed or they are committed, we should have seen representation so that media is capacitated in terms of information sharing. So we really hope that the people, the authorities who have been asked to come and did not come, look for them so that they give you the other side of the story. Don't tire, don't say, Havana kuya. So if I gay, you'll find them. So as National AIDS Council, we believe very much, let's share the story, Yema survivors. But here what I also realized, I'll not be long, ngoti handina kuseta time mayambonditi 3 makanditi 5 saka ndanga ndisina kuzoseta. All right. Saka muna kuzondiudza kuti mandisetera 5. It's okay. Saka ndakupedza hangu. So issues of the COVID survivors and vaccination. Well, what does it mean? I think we need to think about those things. I wanted to say as National AIDS Council, because of our experience here, HIV, NEMA structures at now, these are the same structures which we are working together in the Ministry of Health to disseminate information either on prevention or on vaccination. And I think we're working well together along those lines. And the fact that AHF has invited us, they are also seeing the gap which is there in terms of giving information to the media houses. I will be excited to see your stories. Asingorima updates. Yekuti kwafa vanhu tuna saka Zimbabwe anani. Let's come up with creative stories around COVID-19 which will make people want to read those stories. I'm thinking here, tinonzwa kunzi akazofa nokutanga nema underlying conditions. Chii chinonzi ma underlying conditions. Why ava vauraiwa nema underlying conditions BP, ava vauraiwa diabetes, ava vauraiwa nezvakati. Chii chaitika, chii chinoita kuti chirwere ichi chisvike that level. We need to share that information and then help our people to understand how they can fight COVID-19. Issues of vaccination are very important. If we want herd immunity, inonzukuma 80% of the population, 10 million, and we are still at 2 point chakuti, not even 3 million. So it means munebasa rakawanda. Sezva makaita pa HIV, I want you to encourage you to work even harder. I'm seeing more young people here. You have a lot of energy. Use your energy to achieve the country's targets. Thank you very much.
Thank you.